For us in Jamestown, it is integrated, so we get to work with the GPs across the clinic itself as well as the hospital, which includes ED presentations and inpatients. And then we also have a variety of specialists that also visit for us to also sit in with or work with as well. We're lucky that the GPs up here, they do practice as real generalists and they all have their own subspecialties. So they have a variety of things that they're happy to teach us.
So week to week, I'm often outside of Jamestown, maybe 1 to 2 days a week. So we'll go to either Peterborough or Roo, and we do a lot of parallel consulting. And then the Tuesdays and the Thursdays, we've got all the teaching provided by ARCS as well. And then we normally do a couple of half days in there for study time as well.
Yeah, so we have a very collaborative medical practice that we work in. We work across 3 different sites, so Jamestown, Peterborough and Orroroo, all of which have quite different patient demographics and different workloads there. So our students work with all of the GPs and our more senior registrars, so they get an opportunity to see quite a variety of ways that medicine is practiced, as well as get the opportunity to experience working across the towns.
I would normally round at the hospital first thing in the morning, go and see the inpatients. Then I'd see any patients that have presented to the emergency department, assess them and come up with a bit of a plan. Usually I'd do this in conjunction with medical students, and then we'd come across to the clinic doing some parallel consulting with the students. The day to day might vary. I might have antenatal clinic one day. Another afternoon I might have skin excisions, could have someone in labour doing an induction or a caesarean section, or could have theatre also in the morning, so it really varies day to day.
So my role as a student liaison is looking ahead at the rosters and making sure that each student gets the most out of their rotation, gets a range of different clinical experiences, whether that be with the fellowed doctors or be with the specialists that we have coming. We've got quite a few different specialists.
We've had both teaching provided by university through ARCS, which has been really good. I think we get a lot more structured teaching in the rural program than they do in the city program, which really helps sort of just boost that learning. And because we cover everything through the whole year, it really gives you that good scope. And you'll see something in clinic and you say, oh, I learned about that, a couple of weeks ago, and it works out well. But then the clinic are really keen on teaching students. We have our academic supervisor through the uni, who's one of the doctors here, who will spend time with us doing shoots, but if she's unavailable, one of the other senior doctors will actually take us aside and do tutorials on random skills that they think would be relevant for us or just something new for us to learn. I'm from Adelaide, born and raised, so it's been a little bit different. I've really enjoyed it. There's lots of community sports. So I played netball, haven't played netball since primary school, so it was a big change. That's been really good. We formed a futsal team from some people around the clinic. We didn't do so well, but that's okay. It was good fun. And there's always lots of community events happening as well.
Myself, I grew up in a rural community, so it's sort of gone back to what I'm used to when I was growing up, and everyone knows everyone across the practice, and everyone is related to each other as well, so you have to be mindful of that. But it's very much what I was used to when I was younger as well. We've also been very lucky that as soon as we came in here, everyone was trying to drag us along to things and get us involved in the local activities, whether there's local sports and futsal, netball, footy.
The simulation experience has also been really good. We haven't done so much on site through ARCS. Most of what we've done has either been in Port Pirie or Clare. So all of our anaesthetics, APIC sims, have been with the 3 students based in Clare, just to sort of help bolster our numbers a little bit. And that's been really good. It's hands-on simulation, a whole lot of different clinical scenarios, getting to practice things in a real life environment. And then the other simulation we've done with the ARCS teaching, the obstetrics teaching and then the mid-year workshop in Port Pirie was really valuable because you have, ampules you can crack and you can actually use materials, and it's much more representative of the time it takes during these critical situations to perform each step that we're talking about.
Before this year, we'd had a few experiences with simulation itself, but with this rural year, we actually get to do a lot more, which is very helpful for OSCE scenarios because it's very simulated in those stations as well. So you get used to running through the practice, but it also means we have those skills for a real scenario that comes through with some of our patients. So we get to do quite a few ones and work with do a lot of teamwork stuff with other students as well, which is nice to catch up with them for those. I think it's hard to pick a highlight. I think the whole year's gone pretty fast because both of us have enjoyed being up here and working with everyone.
I've really enjoyed the independence we get based in the clinic, especially with a lot of parallel consulting with the same doctors. They get used to our style and they can sort of gauge our level a lot better. So there's a bit more of that trust between us that I can see a consult and give a relatively short handover, and they can look at the notes and we can move from there, and I can propose plans and assessments instead of what I've previously experienced where it's very much, I'll do something, but maybe after the doctor's done it. The hands-on scenarios, so being the first person to work someone up in ED, getting to do lots of clinical skills like cannulas, bloods, injections, all of those sort of things is also really valuable for your future learning and work as an intern. %. Yeah. It's a really lovely clinic. There's lots of doctors around and everyone's really supportive. There's lots of juniors as well. So we've sort of made it a bit social. We do a games night every week. And we do a dinner at the pub and those sort of things. It's a supportive learning environment because they have so many students and because they've had interns for a very long time. They know how to teach well and they're very used to teaching. And so are the community. They're also very used to seeing students before they see the doctors. That's normal to them, which means that we very rarely get turned down for parallel consulting. So we get to see all sorts of things.
I definitely would. The integrated aspects of it where you can work across wherever there is something for you to pop up with is great. As a small site, I think some people may have concerns with what you may see or if there's limits. We've actually been very lucky about getting a lot of things and doing transfers with MedStar and having unwell patients we've helped manage, as well as we still have one theatre running in Jamestown Hospital. So we've got a few smaller surgeries that come through as well as deliveries for babies as well.
I would definitely recommend they give it a go. I was a rural medical student many years ago in my 5th year, and I would highly recommend it as they really get a lot closer one-on-one teaching. They get to see the same patient multiple times and so get to build up that relationship. Also, I think one of the benefits of being a student in a rural area is the rural communities really value having young health professionals or future health professionals in the region. And so they're really welcomed in the community with open arms, and patients love being able to meet medical students and also follow up with them. So there's a bit of that building of that therapeutic relationship as well.
I feel like everyone should do at least one rural placement. I mean, you have to, but I feel like if you're going to do something, you might as well do a decent one. And so come somewhere that's really rural. Commit, go into the community, being willing to try things, be keen. Rural GPs tend to be more than happy to include you in everything, but you have to show them that you want to be there.
Do it. Go rural. It's a fantastic opportunity to learn a lot about the application of medicine for the everyday person. It's a great opportunity to get your hands in, to be involved. On top of that, the ability to live in a rural community and to see the impact that you can have working within medicine, I think is always fun. You get a bit more of an opportunity of longitudinal care to see how medicine plays out across Australia and to understand the needs that the rural residents of our country have and to experience rural medicine. It's fun.